Hello and welcome to The Print. I am Sumi Sukanya Datta and you are watching Health New. There has been a big uproar in Delhi over a Supreme Court order to round up and detain all stray dogs in the wake of high number of dog bites and cases of rabies. Against this backdrop, the issue of rabies and to some extent dog bites, we have with us two specialists, Dr. Khan Amir Maroof and Dr. Neha Rastogi. Dr. Maroof is the Director of Community Medicine with University College of Medical Sciences and GTB Hospital. Importantly, he is also the honorary secretary of Consortium Against Rabies. Dr. Rastogi is an infectious disease specialist with Fortis Hospital in Gurgaon. Thanks, Dr. Maroof and Dr. Neha, for joining the talk today. Yeah. Dr. Maroof, we all know that India reports the highest number of rabies cases globally. Deaths primarily because we all know that anybody who gets rabies virus and it doesn't get proper vaccination has a fatal infection. So what do you think could be the reason why India, in comparison to the other countries that we sees the highest number of this disease burden?
Uh, yes, you are very right. We see the highest numbers mainly because of our large population size.
Mm-hmm.
That is one of the main reasons. And the other reasons, if I say that the other reasons also that we have a large agrarian community, so rural areas, and also in urban areas, we have vast pockets of underdeveloped areas, which we also called as urban slum areas.
Mm-hmm.
And the practice of a good human animal contact interaction in our cultural practice, that's why this particular uh, what you are saying, that the highest burden is there. So the more the interaction, I don't say that interaction should not be there. It should not be misconstrued in that way. But this is one of the reasons why, some of the reasons why this is highest burden what we see is in India.
Yeah, very important point, that one. Dr. Rastogi, we know that in case of rabies, though it's a fatal disease once somebody has the symptoms, but it can also be prevented, which is a very important point if there is an timely post exposure prophylaxis through vaccination. So despite this, we see rabies cases, which means something is missing, right, in how the disease is managed post exposure. So what do you think are the challenges there that leads to such high number of cases?
True. So actually, rabies is one disease where I should say that prevention is the cure. Usually, we always say that prevention is always better than the cure, but here prevention is the cure. Knowing the fact, as Dr. Marut has also stated, the major concerns are yes, the population, the preventive measures, the awareness of prevention, and the access of prevention. So all these four are very, very important. I would say key points as well as caveats in here. So even if lot of people are do knowing about the post-exposure prophylaxis, which is the main cornerstay of the prevention in the rabies after a bite, but still, as he has mentioned, we are more of the urban slum areas, and there is a lot of awareness missing there. Still, lot of them resort to the local therapies, herbal therapies. Lot of them just ignore the bites by saying a simple scratch or something. Second,
Mm-hmm.
even if you are aware, there is still 20% of the people who does not reach to the emergencies or not have a direct access to the hospitals or for that matter the right vaccine and the immunoglobulins if in the need. And even if they reach, that is already out of the window. That means more than 72 hours or 96 hours after the bite. And then, I mean, I would say there is a very less number as per the data and statistics, but still 1 to 2% cases, the cold chain, the vaccines, how they get preserved, how they reach the centers, how they are effective, even that is also one of the areas of concern. So these are the major points. I would still say that despite on-board vaccination and on-board immunoglobulins, we still baffled and we still struggle in getting the prevention on board.
Yeah. So you have been researching a lot on rabies. One discussion, probably, you have been working with some government committees, probably have been on some of these committees as well. There have been some talks in between to introduce pre-exposure prophylaxis as well, especially for kids in some states, at least where the dog bites incidents are very high. So can you talk a little about whether this can be an effective strategy, and also if it's not available in the, through the universal immunization program that the government offers, is there a possibility that people can, individually, at least because these rabies vaccines are available in the market, so parents can actually think on those lines for their children, especially because we have seen that dogs mainly target kids, right? So that's a reality we have lived with. Not to say that they don't target others, elderly also, but most of the majority of the targets are usually kids. Yeah, Dr. Maruf.
Yes, you are right. This pre-exposure prophylaxis helps a lot
Mm-hmm.
because it gives good protection. And later on in life, whenever there is a dog bite, so you don't need to go for the full course. You only have to get 2 doses, so reduce number of doses. So, and also you don't need to have that expensive rabies immunoglobulin, or also called as anti-rabies serum. So
Mm-hmm.
that way it is very helpful. You just need to get the booster shots. So pre-exposure prophylaxis should be considered. One is at the personal level and one is at the programmatic level. At the
Right.
personal level, I would say that parents should consider it, depending on case to case basis, depending upon the area and the amount of risk. Especially if we look at pet owners, dog owners, and all, even for the matter, cats also the people keep. But here today we are discussing about dogs. So it can be considered. An Indian Academy of Pediatrics in their guidelines for immunization has already mentioned that parents can take this for their kids.
When was
Yes,
this has been
yes.
part of their guidelines for long, of the
Indian
IAP?
yes, IAP guidelines mentions this pre-exposure prophylaxis for kids. Parents can take on voluntary and case-to-case basis. But now, let us talk about the programmatic aspect. Now, when we talk about programmatic aspect, launching something at such a large scale, it is always done in pilot phases. And before that, also we need to conduct some feasibility studies, some effectiveness studies, because when we launch it in a programmatic mode, we need to see, because kids are already getting many vaccines, right? So many needle pricks are happening, injections are being given to a child, and till the age of 1 year there are scheduled visits to the clinic for immunization. Now in order to add on to that, more visits if we add, or should we add more injections during the same visit? These are operational research, also seeing whether the vaccine that is being given at that time, how it is working, to what extent it is working. We will need more data and evidence before we can, because these things are being recommended ultimately by the top level. There are various bodies, regulatory bodies in our country to safeguard the interest of the patient, and we have to give evidence to those bodies, and then it will get approved. Apart from what we saw in the COVID time, because that was a emergency, and at that time fast approvals and things were happening because we had a lot at stake. So, but here we can't say that this is a COVID type of emergency. Media uproar, and this cannot be considered as we can't equate it with that kind of disaster that was a pandemic. So here we will need more evidence, more time, more understanding, and then in pilot phases it can be implemented. This is my opinion on that.
Yeah. So, as we know, for any vaccination strategies, there is risk benefit analysis that is done, and as Dr. Maruf pointed out rightly, that it's a government committees, the top advisory vaccination committees, which make these recommendations, and if the government thinks appropriate, they implement these. Dr. Maruf, you also mentioned about immunoglobulin. Now, Dr. Neha deals with such cases probably in huge numbers. So, can you talk, in earlier times, we know that whenever there would be a dog bite, there would be many number of injections that people needed to take. Now these numbers have considerably come down. You don't need as many injections, but what exactly is the course of these vaccinations, and also in which cases specifically are immunoglobulins required? Can you talk a
Right.
little about that? Dunya.
So rabies, when we talk about prevention, we have two aspects. One is the passive immunity. You give something on the board and you will have an instant blockage of the virus being circulated into your nervous system, because rabies virus usually affects your nervous system down the line. And then there is
Mm-hmm.
something called the active immunization, which comprises of the vaccine. So what we do usually is, irrespective that you have an active animal bite, I would say specifically we are talking about the dog bites today, vaccinations, 5 dose schedules of the intradermal, something for the active immunization after
Ma'am,
the
sorry
dog
to
bite.
interrupt, but that bit I need to. I would just point out to request you to repeat that bit because we just lost you there. There was
Yeah. So I was
interruption.
mentioning about that irrespective of the dog bite, we have the types of dog bites and the categories. So when I was talking about the active immunization, that is the vaccines specifically, they need to be administered either an intramuscular schedule, which is 5 doses for the usual adult people or the children, and 6 doses sometimes for the immunocompromised who does not have a good immunity to compromise as an additional schedule. For the
Mhm.
passive immunization, which is rabies immunoglobulin or the anti-rabies serum, they have been indicated in the few situations. When you have a severe bad category 3 dog bite, that means you have a proper ooze of blood, there is a skin flesh which is being taken out. Any bite which has been done on the face and the neck, which is closer to your brain and the nervous system, supposed to be given with the immunoglobulin or the anti-rabies serum. And in certain cases where we see that the patient is relatively immunocompromised, too young, kids specifically, when they have the bite which has not been noticed very urgently, and then they have been mentioning that, okay, it has been noticed within 24 to 48 hours. Benefit of doubt, we do give to that patients as well. So, majority anti-rabies serum for face and neck, immunocompromised people, and any kind of deep dog bites that has to be given, whereas vaccines can be given in all the category of dog bites.
Yeah, those are very useful tips. Now, sir, whenever we talk about rabies, vaccine is one thing that's a parallel theme because it can only be prevented through vaccines. But the concern in India has also always been about also the lack of these vaccines in many government hospitals apart from private sector, especially during the COVID times. We saw because the vaccine manufacturing was largely diverted towards COVID vaccinations. So there was a huge supply issue in between. But what is the status now? Because Dr. Maruf, you work in a government hospital. You probably would be knowing about these details in more detail. So can you talk a little about how big is the challenge of vaccine supply in India?
Um, that's a very good question. Actually, vaccine logistics is an issue, a
Mhm.
big one. And right now, if I talk from the Delhi perspective, it's different, but I can't say that I can't generalize this to all over country.
Right.
But the problems are similar more or less at various places. So
Mhm.
first of all, if we look at from the production point of view, I think India has been a leader in production of vaccines. So vaccine manufacturer side, I think there would not be much of a problem in supplying vaccines. When it comes to immunoglobulin, yes, there might be limitations if we talk about pan India supply, pan India delivery for everyone, like when we talk about universal immunization. So
Mhm.
that has to be looked at. But when we look at the logistics point of view, see the regulatory requirements and all has to be followed, and this is such something that companies are also dealing at an international level. It's not that the vaccines which we make in India, they are also exported to the various other countries.
Mhm.
So now what happens is that depends upon how much vaccines estimated will be procured in our country. How much vaccines will be procured can be procured by some state, and then there are different manufacturers. So what happens is depending upon whether if they are assured that okay they are going to get an order of a contract of this many vaccines, so they can make it ready. It is very difficult to have it known beforehand, because then the fair competition will not happen. So this is some challenge that the large demand that is there, that is important. So I think governance and leadership is should play a major role in seeing it to it that whether it is at the local level, regional level, state level, or national level, at every level, I think governance and leadership is important to plan, to find out like what will be the requirement beforehand in the next financial year, and then accordingly place orders well in time, and then have it there, because this vaccine is not available very easily in the private market, because of low awareness, and also at times cost, and many injections are to be given. So we see, and this dog bites mostly happen in children, and also in the rural areas and slum areas. So what happens, the lower socioeconomic strata mainly gets affected. So in that case, the demand in the private pharmacist shops, it is difficult to find these vaccines, and also immunoglobulins further harder to find because they are again costly, and also people are not much aware about that. So looking at this scenario, I think I would just place my comment here that governance and leadership at each institutional level, local level, regional level, and national level will have to step in to sort out this issue, and then we collaborative with a collaborative approach along with the manufacturers and all.
Thank you so much for those pertinent, very important points. Now, our discussion has largely been about health aspect of rabies, and rightly so. But all the hangama that we are seeing is about how probably there has been an order to control the menace, which is to uh, round up and detain the dogs, and not many people are actually, especially the dog lovers, are not happy about it. But Dr. Maruf, probably you will have to take up this question because you have worked in this area extensively. So what do you think about this particular strategy as a tool to control dog bites and rabies? Do you think it's effective? What's your opinion on that?
Uh, I, on the one hand, welcome this decision, because if this decision would not have been made, or this order would not have been passed, I think people still would have not looked at the condition of the dogs in our areas,
Mm-hmm.
the dog shelters in our areas. So I think this has opened up, this has brought the spotlight on the condition of dog shelters, and the condition of the animal birth control programs, the their status, which should have been in place till now. This particular order brings out, it lays bare all these inadequacies in the proper, I would say, animal birth control, and taking care of the animals in a proper manner. We have not been doing this, and this is a wake up call. I think the debate, it should not be limited to a debate that okay, this is good or that is good, this is bad or that is bad, this is against that. I think this is in favor of the dogs also, in favor of the humans also, both the components. Because if we talk about this as at a larger scale, then what we need is proper animal birth control program, the proper implementation, and good this dog shelters in the cities. So it will have to be chalked out. The plan has to be chalked out, I think. So I would not go into the implementation part. How will it be implemented? Actually, that there can be a, people can speculate that okay, this will be very bad for the dogs. It should not be, actually. It should not. Why should it be bad for? If some dog shelters have to be created, why we can't trust that? Why we can't say that yes, good dog shelters should be there in our cities? I think it should be there in our cities. We see animals in pathetic conditions at various places. So that should not be the norm. We should take care of the animals. We should not just give them some food and leave it on the street just like that. Whatever happens, I have done my duty. Now I don't care. So we taking full responsibility or are we just doing something for our own satisfaction? Okay, I did this, that's all. So we have to look at the larger picture, and also we can't ignore the by number of bites that is happening with the hospitals, the large number of patients, and the condition, the way the maulings happen. So those people, those kids, those parents, who are afraid to send their child outside, even adults are afraid to venture outside after hours, and even early mornings, even for morning walk, people don't go out just because if I go there, there's a risk of the being bitten. That kind of fear should not be there in the society, for people also and for dogs also. So I would say that working for in prevention of rabies, I have learned that we cannot prevent rabies by hating dogs. That is the wrong approach. That is incorrect approach. And creating dog shelters should not be considered as being against dogs. Yes, how it is implemented, we will have to wait and watch, and what is done. But I am seeing more and more news on how the pathetic condition of dog shelters, and I'm happy that it is being brought out, because then
Yeah.
I think something will be done rather than keeping it under wraps. That is the wrong approach.
The key message here is that, while don't treat bad dogs badly in this entire process, human safety should also be prioritized, because these incidents are real, and there are real people getting affected. Dr. Neha, last words from you on, what do you think can be the quick tips that you advise to people who have probably been bitten by dogs, and they can do in order to prevent rabies, which is very important.
Right. So first of all, from the perspective of the bite, as we know, unprovoked bites are still very common. But many a times for the kids, and especially when we are hearing a lot of things all around, I think just a imperative, because it's a mutual conjunct also. We need to talk about both the fundamental as well as the statutory policies as well. So first thing is practicing with the kids, those kinds of bites in terms of both the adults and the kids. Second, if somebody is bitten by the dog, or for that matter, any wild animal, do not panic first of all. Clean it with the proper soap and water. Don't apply some kind of antiseptics or any kind of herbals, say haldi or anything. It's not going to help as such. Reach out to your local authorities, government or private, both have been no dearth of vaccines for that matter. Reach your local doctor, understand the severity and the type of the bite, get your vaccines on board, and get the appropriate first aid or medications, whatever required for the local wound condition.
Yeah. So one thing, probably correct me if I'm wrong, is, because Dr. Maruf also said that, in privately, many pharmacists don't even keep rabies vaccines most of the times. So the best way, especially if you are in a city, probably is to go to a district hospital, maybe because, supplies are likely to be better there in those places, right? So every time there is a dog bite, do reach out to a healthcare provider in your, probably in a district hospital or a government hospital. It will be a better bet. So thank you so much, Dr. Maruf and Dr. Neha. Really appreciate that you could join us in this very important conversation, which has become a sort of hot topic these days. Thank you so much.